The H1N1, or swine flu virus, has caused a media frenzy and panic in the general population, mainly because those who are most affected by it seem to be quite young. Hi, I'm Rebecca Brayton, and welcome to WatchMojo.com. And today we'll be learning more about who's at risk for H1N1, as well as how to avoid getting sick, and what to do if you do fall ill. Why is the H1N1 virus causing so much concern?
When it first manifested itself in Mexico, it killed a lot of young people, created a lot of anxiety.
How is H1N1 different than the seasonal flu?
The difference is primarily that because it's a relatively novel virus, few people have immunity to it. The other is the age group that it seems to be hitting, and that's primarily young people.
And what are the symptoms?
They're the same as with any other flu, and so you have a fever, coughing, chest pain, shortness of breath. So it's sort of a thing that's here, as opposed to a cold, which is up here, which is the nasal congestion and the like.
How does H1N1 kill?
Frequently, it's not necessarily the virus that sort of causes death in people. It's that it sort of weakens the system and then other infections take over.
And who is most at risk?
Those people who have asthma, for example, cardiac problems, people who are morbidly obese, people who have other medical conditions that are taking medication that will suppress their immune system.
What are some tips for not getting H1N1?
Social distancing, hand washing, sneezing in either a handkerchief and then washing your hands, or if you don't have a handkerchief, in your fold of your sleeve.
Who should get the H1N1 vaccine?
At this point, obviously, anybody who is part of a risk group, because they're more at risk to develop complications.
How is the illness treated in most cases?
If you catch it early enough and you are a person that's at risk to developing problems, you can certainly use antiviral medication that are currently on the market.
And if you think you are infected, at which point should you seek medical care?
If you're having a lot of problems breathing, if your fever doesn't seem to be stopping or being controlled by the use of anti-fever medication, if you're having coughing that's really deep and difficulty to bring things up. There's some GI symptoms, gastrointestinal symptoms, and if you're having lots of nausea and lots of diarrhea and potentially getting dehydrated, then again you need to be assessed. For most of us, if you stay at home in bed for a couple of days, drink plenty of fluids, control your temperature, you'll be fine. You'll feel like crap, but you'll be fine.
Well, thank you very much.
You're welcome.